Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us, flowers, leaves, and roots within. Hear the mind calming you, soothing you, love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herbs.
Hello and welcome to the Middle World Herbs Natural Wellbeing Series, where we talk about restoring and maintaining your health in safe and natural ways, while incorporating both the physical and the emotional sides of healing. We go live twice a week on Wednesdays and Thursdays at 4 p.m. Pacific Standard Time. And each week we talk about a different aspect of health. Today's episode is called From My Heart to Yours, and we're going to focus on heart and cardiovascular health. And did you know that the first evidence of heart disease has been found in 3,000-year-old mummies? So it is as long ago as the first known herbal remedy for heart conditions. And if you're curious what that was, today we're going to be talking with an expert about regulating blood pressure in natural ways, heart disease risk factors, and will reveal the secret of this ancient remedy. My name is Deanne. I will be your host today, and I'm here with our very special guest, Dr. Jacquie N.D. She is a naturopathic medical doctor, board-certified holistic nutritionist, and psychology enthusiast. Dr. Jacquie, welcome as always. Thanks for joining us on our show, From My Heart to Yours. And let's just go ahead and have you introduce yourself and tell us about your journey towards naturopathic medicine.
Yeah, of course. So I'm Dr. Jacquie. I'm a naturopathic physician. I've been practicing for almost 10 years now. I'm also a holistic nutritionist. And I am, like she said, an avid psychology enthusiast. And I think, well, outside of what drew me to natural medicine, I think the biggest thing or connection that I learned that has to do with cardiovascular health is that most drugs that are utilized to help protect the heart and or make it function better are actually derived from herbs and natural substances. So I just wanted to go directly to the source when I decided to go to medical school and just learn about the whole plant itself, different foods, different compounds, and things like that. So I think that that's absolutely fascinating, and I'm just excited to talk about it today.
Awesome. Well, let's start with the bigger picture. So how big of a problem is heart disease in the U.S. and in the world, and has it always been like that?
So in the U.S., as most of us know, it's a leading cause of death. 1 in 4 people will suffer from some sort of cardiovascular disease, or CVD as it's known. In this country, I believe someone dies every 30 to 45 seconds from cardiovascular related diseases. And it costs billions, hundreds of billions of dollars a year in healthcare expenses and lost productivity in the workplace and things like that. So it's a pretty huge deal. It's so big, it actually claims as many lives as every single cancer combined with every lower respiratory disease. Combining those two classes of disease states equates to how big of a problem cardiovascular disease is in the country, in the US specifically. So it's a really big deal. And it happens a lot. So it hasn't always been that way. Life expectancy used to be 47 to 48 years old in 1900. And when modern medicine started developing, the focus was really on infectious disease, right? We weren't looking at chronic disease. A lot of people were dying of things like tuberculosis and pneumonia, things that we believed were preventable. And that's when we learned about bacteria and viruses and how we can address infection. And guess what happens when you heal people of infections? They're not dying at 47. They're living till 60 or 65. And what happens to increase with age? The risk of heart issues, the risk of circulation issues, of cardiovascular disease. So, like, for example, somebody who's 85 has a 25 times higher chance of having a heart attack than someone 45. So in the last 100 years, we've added, that 30 to 40 year additional lifespan. We've almost doubled the lifespan in the last 100 years. And so that's longer that the system has to work. That's harder that the system has to work. So no, initially at the turn of the century, or I should say the 19th century, we were really heavily involved in infectious stuff. And so we didn't really know about heart disease. And then mid-century, around the 60s, it really spiked. We saw a huge, convenience foods, fast foods, all of these things increased, high consumption of LDL, better medical tools to be able to diagnose it and catch it. And so all those things combined to kind of the perfect recipe for heart disease now becoming a really big factor in American culture and American epidemiology, or the study of diseases. So it wasn't always a thing. And then it became a thing. And now, not only is it a thing, but it's a pretty big thing.
It's the thing, right? Yeah. Wow. Okay. Well, for all our friends who are listening now and just joining us, if you guys have questions for Dr. Jacquie, especially about this topic, just type it in the chat, because we do answer questions live. And then the first question for you is just, how does heart disease run its course? So does it what makes it start? What happens in the body over time before it gets bad?
That's a really good question. So our body is made up of a bunch of tubes. It's a big highway system of tubes that carry blood, and half of them, known as arteries, carry oxygen-rich blood to places. And then the other half, known as veins, carry deoxygenated blood back to the heart and lungs to be reoxygenated to go through arteries to switch over to veins. And where they connect is known as a capillary, where an artery becomes a vein. The in becomes the out. So anyhow, this massive network and highway on the inside of every single tube, like if you cut it in half, almost like those commercials when, you want to look at it, it's like declogging your plumbing, and they do the cross section of the pipe and you see all the sludge. That's essentially what the inside of kind of a plaque coated artery is going to look like. And arteries are what get the disease because it's a high pressure system. Because again, all that blood is leaving the heart and going to the rest of the body. So it's a lot of pressure. So anyhow, on the inside of those pipes, if you will, is a layer of really sensitive cells. And those cells can get damaged. We can beat it up. If our blood pressure is really thumping and really hard, that's going to bang into the wall of those arteries every single day, thousands of beats a day. That's going to damage that really gentle, kind of vulnerable layer. Now it's meant to expand and contract. It's not super vulnerable, but it's vulnerable enough to where it can only withstand so much. So high blood pressure can start to cause damage to those cells, for example. Mismanaged blood sugar can do it. Tobacco, alcohol, carcinogens, fumes, pollutants, all these things can damage those cells. And when those cells get damaged, what do? They reach out to the immune system, say, hey, I need help. And we send white blood cells to help repair the area. And in that process, cholesterol and things are getting caught in this damage on the inside of the pipe. So to try to protect itself, the inside of our artery lays down a thin layer of smooth muscle to try and keep that plaque at bay. And what ends up happening is the walls thicken and constrict. And now this pipe that used to let this much blood through, the walls have thickened, closing the amount of space where blood can get through. And all those walls are thick, they're hard, and they're full of plaques. You get a big jolt, you have increased stress, something terrible were to happen to you physically, emotionally, something happens just the right time and place, and boom, if you get hit in that right spot or something were to, lodge loose, those plaques now will get into the space of the artery, causing a clot known in the heart as a heart attack and in the brain as a stroke. So it really just starts with our lifestyle, our diet, our age, all of these things potentially causing damage to that inside lining. And the rest is just our body trying to protect itself. But sometimes, after a lot of damage is done over a long period of time, it's doing more harm than good. The body's attempt to protect itself is now causing disease states.
Got it. Okay. Well, the heart is clearly an amazing organ, and I want to do a quiz with everyone to see how much we all know about the heart. So we're going to do a 10-question heart health true or false quiz for everyone who's watching us. We also have some heart jokes available because those are always fun. Make sure you hit the follow button. All right. So this is how it works. You need to type in true or false, super simple, into the chat, and then Dr. Jackie will give us the correct answer. I also haven't researched this, so I'm going to guess along with you guys. Okay, so question number 1. A woman's average heartbeat is faster than a man's by 8 beats per minute. True or false? I'm going true on this one. Women have faster heartbeat.
Yeah, you're absolutely right. So the smaller the individual, the faster the heart. And women are usually, not always, obviously there's exceptions to every rule, but genetically tend to be slightly smaller, shorter, things like that. And so because of that, the heart is a little bit smaller, which means it has to pump faster. So yeah, it is a little faster, about 8 to 10 beats per minute faster.
Okay, yeah, the reason I kind of knew that one was when there's like an old wives' tale to figure out if you're having a girl or boy, because your first appointment, you basically can only see a heartbeat. And if it's a higher rate, they say it's probably a girl. And if it's lower, it's probably a boy. So
that's super interesting.
Yeah.
Okay.
It's not like official science, but I feel like it's an old wives' tale for a reason. So
that's cool to know. I had never heard of that, believe it or not. Okay.
Yep.
Note to self.
All right. So here is a joke. All right. So I have a joke about hearts, but I don't think you're going to get it. Do you know why?
Why?
Because it's an inside joke. All right. I might be our corniest one.
One of those nights. Yeah. All right, let's strap in.
Yeah, strap in. It's going to get fun. All right, question 2. The heart pumps all of our body's blood volume through 60,000 miles of blood vessels with each beat. True or false? Wow, that is a lot of miles. I'm going true.
So the question is technically false, but elements are true. So the false part is that it doesn't pump all of your body's, all 5 liters of blood in every heartbeat. 5 liters of blood doesn't go through the heart with every beat. That's too much. You probably get about 1/3 of a cup, which is like 50 to 80 milliliters. Okay. So basically it takes anywhere from 60 to 90 beats for all your blood to go through your heart. So about every minute, instead of every beat, all your blood going through all 60,000, feet of blood vessel, it's about every minute, not every beat. Still a lot. Still working pretty hard.
That is a lot. Totally. Yeah. All right. Question 3. Drinking beer increases your chances of heart disease. True or false? Drinking beer. I'm going to say true. And my dog agrees.
We got some pups going on. Okay, so studies actually have shown, there was a preliminary study done by the American Heart Association, and they followed 80,000. That's a big sample size. 80,000 people for 6 years, and found that moderate drinkers of beer had a slightly lower decline in the good kind of cholesterol. So they were able to maintain good cholesterol, and they showed slightly lower bad cholesterol, which both had kind of more cardiovascular protective properties, which I think is pretty fascinating.
So it's false then, right? I'm like, what? Well, first of all, I need to shut my door, but I'm hoping my dog just
Feel free. I got the crowd. No. So what the studies were showing is that moderate consumption of alcohol can actually be good for the heart because it increases what's known as good cholesterol. And good cholesterol does not add to plaque formation. It does not add to hardening of the arteries. It's actually very protective of things like joints and helps make good sex hormones and other things in the body that are important. And so moderate intake of alcohol, anywhere from 1 to 4 or 5 beers per week, was shown to actually help prevent the decline of that HDL. So the good cholesterol stayed at a good range, and the bad cholesterol stayed at a low range, which I thought was pretty fascinating. And beer in particular is usually made out of hops, and so hops are known as a natural sedative, so they can actually help lower or depress the central nervous system and show to be less damaging than something like wine or alcohol directly, like hard liquor. So although it's not 100% conclusive that it's cardioprotective, let's say, or prevents cardiovascular disease, it does help with cholesterol levels. And we all know that wonky cholesterol levels add to heart stuff. So, you know, it could potentially protect the heart and cardiovascular system, which I think is really interesting.
Totally. All right. Well, we have asking for a friend. What about whiskey or something stronger than beer?
So the study compared the three, hard liquor, wine, and beer came out on top. Liquor had the most damaging effects, but wine and beer actually helped, and beer helped more than wine, believe it or not. Because I think a lot of people associate resveratrol and wine, and like one glass of red wine a day is great for you. But it actually showed that wine and hard liquor produce inflammatory cells that for some reason beer doesn't produce in the body. So
Interesting.
Yeah.
I just associate like beer leads to bad food choices like pizza and wanting pretzels with cheese and like all kinds of things, but it's really interesting. Okay, so James is doing a follow-up question. What about something with more hops like an IPA? Would that be better?
A hoppier beer is going to just have a more sedative effect versus like a more cardioprotective effect. It has to do with, I think, like just the brewing process that all beers have to undergo. That's what actually does not produce homocysteine like wine and liquor. And homocysteine is damaging. It's inflammatory. And so the hoppier, the more herbal, which means the more sedative effect and more nutrition, believe it or not, because hops are nutritive. They have some minerals in them. But when it comes to the cardioprotective, almost any kind of beer has been shown to have that effect.
Wow. So Germans are doing real good because they celebrate their beer with their
Oktoberfest. And fun fact, want to add this in. They used to, Eva let me know this. I did not know this. This is a new information to me. But they used to add cobalt, the metal cobalt, to beer to make it foamier, and then that actually caused heart damage.
I think they took that out.
Beer? I don't understand, but whatever. Apparently it used to be a thing. So
it must have been a thing. Yeah. Most nowadays it's like you have to pour it like perfectly. If you give someone a foamy beer, it's like pour it again.
They're like, no. They turn their nose up.
Yes, that's so funny. All right, ready for a joke? So this one is, what did the cardiology patient who didn't have a heart transplant say?
What?
I had to change a heart.
By the way, I deleted all these, so I don't know what you're gonna say.
Good.
I didn't want.
No, because it won't be funny if you. And plus, when it's off me on the, I'll Google a few more. I'll try to find some other ones. Yeah, that's good. Okay, question four. The beating sound of the heart comes from the heart hitting the rib cage. True or false? I'm gonna go false.
Yeah, you're right. So that lub-dub sound, as it's known, lub-dub, is actually closing of the heart valves as the blood pumps into and out of chambers. So two valves are closing and opening at the same time, depending on where the blood's going, because the heart's doing a bunch of stuff at once. But that lub-dub, that's the thump of those valves suctioning opened and closed, because they need to be so pressurized because they're taking care of such volume that we need that nice firm snap. So when you hear like a whoosh or not a clear lub-dub, you could have a valve issue. That's a way to tell. Like a murmur.
Interesting.
Yeah.
Murmur. Okay, this joke's a good one. I like this one. What's the easiest way to a man's heart?
I don't know.
Through his chest. Just reach it.
I didn't know it was going to be so literal. Come on. Okay.
Oh, these are like med school jokes. All right,
very, very literal, and I like it.
I know, they're good. Okay, question 5. The heart is about the size of 2 of your hands clasped together. So, that size? Yeah, I'd say so. True.
You are absolutely right. So when we clasp our hands together, this is about the size of our heart. And pardon me, when we're a child, before we finish puberty, in our early 20s, our heart is about the size of our fist.
Okay, so it really doubles, basically.
Yeah. Well,
Wow.
I mean, 1.5 times.
Yeah. 1.5. Yeah.
There's just more tissue to support, so it's got to get bigger and stronger.
All right, next one. Why did the boyfriend send pictures of his heart x-ray to his girlfriend every month?
Every month? I have no idea.
He wanted to show that his heart was in the right place. You want me to read that again? Okay.
Like he was to her, so it would be in the right place.
Yeah, so he's
like
saying my heart's still in the... All right, that one was a flop. We'll say no on that one. All right, next question. All right, is it possible to have a broken heart, literally, or all right, let's see, literally, not only figuratively. So can you literally have a broken heart? Oh, like it breaks? Probably false. I'm gonna go false.
So it depends on what you mean by breaking, but people who have what's called acute coronary syndrome, or they go to the hospital or urgent care for heart issues, acute issues, like they don't have a long-term disease, they don't have hypertension, nothing chronic or nothing they're on meds for, it just pops up. About 2% of those cases are actually known as, it's called stress cardiomyopathy, or say this 10 times fast, Takotsubo. Takotsubo, named after the person who founded it, cardiomyopathy, or better known as broken heart syndrome. So it's a real medical thing. The heart doesn't necessarily break per se, but it does not work as well, and the symptoms are mimic the symptoms of a heart attack. So
wow,
it's more prevalent in women than men. But again, yeah, it's a real thing. Like you can actually have broken heart syndrome on a medical chart. I mean, obviously it'd be stress cardiomyopathy, but the common name is broken heart syndrome.
Wow. All right, let's do a joke. What vegetable is the most loving?
A heart of palm.
Ooh, you're so close. An artichoke, because it has a heart. I guess we could give you a heart of...
Oh, man! I was swirling that drain, though. I was real close.
You were like, right? I mean, I feel like we should give you your answer there. That was good. All right, number 7. The number of heart attacks peaks on Christmas Day. True or false? Oh, let's think about this one. True.
You're absolutely right. The 2 biggest peaks of the year for heart attacks are Christmas Day and New Year's Day. So, and Christmas out edges New Year's just slightly. But yeah, it's been studied time and time again. The last couple decades, cardiac events happen more during the winter holiday anyway. For a multitude of reasons. People aren't exercising as much. We're eating really rich, fatty foods. The stress is really, really high. So it's kind of like the perfect recipe for cardiac events, or heart palpitations, increase in pulse rate, blood pressure, all that stuff. So yeah, I guess it all comes to a peak at Christmas and New Year's. It's almost like, I think of it like the anticipation of everything and then the body finally relaxing. But believe it or not, that tight kind of restriction and then relaxation can sometimes throw clots. So it's interesting that it's on the actual days, right? When you're meant to relax and enjoy and all the preparation is kind of over. But that's the height of the year where it's happening.
Wow, I had no idea. That's really interesting. That's crazy.
I know.
I'm just reading the next joke. What are 2 bakers in love called?
What are 2 bakers in love called?
Mm-hmm.
Man, I got no idea.
Sweethearts.
bakers. I get it. Okay. That's a little stretch. Come on.
That's a little stretch. I know. It was like, it should have been like 2 cookies in love or something like that. All right. I need to rewrite these jokes. All right. Question 8. The heart has its own electrical supply. True or false?
Mm-hmm.
Oh, that's interesting. Well, I think, people can get those pacemakers put in. So I'm going to go true.
Yes, absolutely. So, the heart has its own conductivity system. And so if you've heard me in previous episodes, if you remember, Deanne, me talking about coherence, electromagnetic coherence between people, and how we can't read minds, but we can feel more in tune with, or in flow with, or good vibes with specific people and animals and things like that. And a lot of times there's a theory that we have electrical coherence, aka like our heart is, the love dove is in a similar rhythm as the other person. So our electromagnetic, conduction that's happening is at a similar pace, or a symbiotic kind of tone with another person. And so we get coherence. And I think that that's really fascinating. And that happens anywhere from as early as 3 weeks to as late as 6 weeks during embryonic development. All of a sudden, we just go from these cells multiplying, and then electricity. And that electricity stays with us for the rest of our life.
Wow. Interesting. That's so fascinating.
It's very cool.
Okay. That is cool. Question number 9. Every cell in the body gets blood from the heart. True or false? Every cell. True.
Oh yeah, absolutely. So we have major vessels with branches on branches on branches on branches. Some capillaries are as thin as they can only fit one red blood cell. That's the diameter of the capillary. And that's going to go into and feed every single cell in the body everywhere that we go. So when we're talking cardiovascular health, it's literally the quality of everything else. Between digestion, which puts nutrition in the cardiovascular system to shunt it and send it everywhere, things only get to places as well as our cardiovascular system is working, because it really does go everywhere. And so, it's such an important system. But anyhow, sorry, yes. Every cell in the body.
Nice. Okay, question 10, our final question. Hummingbirds have the fastest beating hearts. True or false? That's an interesting one. We'll go true. They're fast.
It is definitely up there. It's definitely up there, but it's technically not the fastest. The pygmy shrew is a tiny, tiny, tiny little mammal. And its heart beats about 1,500 times a minute, where the hummingbird is like 1,000 to 1,200, I believe.
Okay, interesting. All right,
yeah,
another joke.
Okay,
yeah.
Let's hear it.
Okay, I rewrote it in my head right now. So
okay.
Let's see if my version could work. All right. What did the heart say to the other heart who had a really big ego?
No idea.
You're so vain.
How did I not see that coming? Of course. Oh man, that's a slapper if I've ever heard one.
That's a good one. That's a good one.
All
All right.
that's a good one.
Thank you.
What?
What?
I said that's one I might use.
Yeah, I used that one. I rewrote it. So if you need the rewritten version, let me know.
I love it.
All right. So thank you everyone who played True or False with us. And now we can talk about that first evidence of heart disease found 3,000 years ago in mummies. And it's also was known as the first herbal remedy for heart conditions was around that time. So Dr. Jacquie, what can you tell us? What was the herb that was used by our ancient ancestors for treating heart-related ailments?
So yeah, the alkaloid berberine, which we've talked about a bunch of times, it's been used for 2,000 to 3,000 years now in traditional medicines like Ayurveda, which is widely used in India, as well as traditional Chinese medicine used in China, of course, where thousands of years, hundreds of years, certain practices have gone on, very esoteric. But yeah, berberine, different plants that were really high in berberine were used often, mainly for infection and mainly to help with weight issues. Before we knew diabetes as its name, diabetes, there were certain signs and symptoms associated, right? So when you see it in traditional medicines, they would use plants that were high in berberines and alkaloids like berberine to be able to help address it. And so it's actually not until more recently, the last probably decade or two, where we've studied berberine at length for things like congestive heart failure and other cardiovascular issues. And it's so cool because it's shown time and time and time again, it significantly helps things like ejection fraction, which is how much blood is being pumped to the body from the heart. It helps people maintain a good heart rate throughout a 6 to 12 minute walk when measured. So it helps with the integrity of everything, the viscosity of blood. It can even elongate life in later years. There was a study done actually, I think among 80 something year olds, and they were followed for 12 months and given berberine, and they all had congestive heart failure. And there was 16% of the group not given berberine had passed away within that year, the mortality rate just given the age, compared to only 8% to people taking the berberine who had their mortality rate. So almost double in the group with no berberine. So that just goes to show that really added years onto their life, literally by taking berberine and increasing their cardiovascular health and integrity, which I think is pretty cool. So they knew back then, and now science is proving it now, and I love it when that happens. When esoteric medicine like that, traditional medicine gets proven, it's just so fun and so fulfilling for me personally, because I love tradition, but I also, if it ain't broke, but I also love to know why does it work? And my sciencey brain just gets so excited.
That's so awesome. Well, I want to introduce everyone to our 2 supplements because we have 2 different berberine capsules here. So we have our berberine HCl. This one has bitter melon and banana leaf. And then we have berberine HCl Forte. So we have 2 different ones. And Dr. Jacquie, berberine is considered one of the wonder herbs. So why is that? And could you share with us a little more properties about berberine?
Yeah, of course. So berberine just checks a lot of boxes. So it's because of the way that it works, the plant extract being an alkaloid, it can address a lot of different cell problems. And so it's what's called anti-proliferative and anti-metastatic. Well, what does that mean? It stops proliferation or growth of cancer cells. And anti-metastatic, against cancer moving to different organs. Once something's metastasized, that means it's gone from the original organ to an additional organ and it's spreading. And berberine has been shown in cancer cases and cancer studies to be able to do both, right? To stop the cells from multiplying and stop them from migrating to different organs and tissue types, which is pretty powerful stuff. So in terms of cancer and all that, in that area of health, it's helping significantly. Then we move on to something like blood sugar regulation and giving our brain enough glucose to function, our muscles, preventing our blood sugar from crashing, causing mood issues and heart issues and all that. Berberine was found to do that thousands of years ago. Actually, we knew about its ability to do that. That was one of its traditional uses, was for weight management, and they didn't know it by diabetes back then, but diabetes-like conditions. Then fast forward even further, and we're learning that it's got this amazing cardiovascular effect and helps prevent damage to that layer on the inside, like I was talking about. When that damage happens, berberine is fantastic in helping address that. It helps lower blood sugar, like I was saying before. It helps strengthen the integrity of the heartbeat. It helps protect the heart from different conditions, especially inflammatory conditions. It's known as a wonder herb, to answer your question, because it does so many different things, which is kind of rare. Usually, you have 1 or 2 superpowers for a plant or a substance, but when something does 4, 5, 6 things, that's really where science kind of piques interest and says, hey, we have to understand this more and what's going on. And berberine is one of those things.
Awesome. Well, I want everyone to see the capsules. So they have this beautiful,
And a bright
intense
yellow, yes.
yellow color. They're so pretty. So they have that gorgeous yellow color, and this supplement has an unprecedented 97% purity, which is confirmed by third-party testing. And both of them, they're veggie capsules. You're going to get 60 per bottle. Berberine HCl Forte is $19.49, and berberine with bitter melon is $21.49. And don't forget, you can take an extra 20% off during our live. So put that into your cart. And Dr. Jacquie, I'd love to take a deeper dive into the topics of cholesterol and blood pressure, since berberine has been traditionally used for supporting healthy levels of both. So let's just start with some of the basics. What is normal blood pressure, and what's the difference between systolic and diastolic blood pressure, and are they equally important?
Lots of good questions. So whenever you go to the doctor and you get that cuff put on your arm, they're measuring your blood pressure. And there is a top number and a bottom number. The top number should be bigger than the bottom number. And the top number is known as systole or systolic blood pressure. And it measures the force of the blood against the artery walls, while the ventricles, the big lower chambers of the heart, are squeezing and pushing blood. And so when the ventricles work, that's systole, and that's the top number. And they need to work really, really hard, a little bit harder than the top two chambers known as atrium. So atrium are small and they kind of sit on top. And then you have your big ventricles at the bottom of the heart. And the reason why the ventricles are larger and have to pump harder is because this ventricle, the left, is pumping blood all the body, and the right is pumping blood into the lungs to get oxygen. And the atrium are just there pumping to the ventricles. So they're not really doing as much work. And so that number is smaller, and that number's on the bottom. That's called diastole or diastolic. So you have a big systolic, the whole system's getting blood, and then you have the smaller diastolic, or the heart is filling with blood. And so both numbers are really important, although it has been shown that disease is more highly correlated to elevated diastolic, or the lower number being higher. So normal would be 120/80. And anything higher than that, we're starting to get into elevated blood pressure. And right around 130 to 140 over 80 to 90, that's when we're looking at, it's called stage 1 hypertension. And then it just goes up from there. And then you can also be what's called hypotensive, which is really low blood pressure, which also isn't good. We want that really sweet spot middle ground. And that's going to be 90/60 or lower, right? So 90 the low, 120 being the high. That's the range, healthy range, 90/120 top number. And then bottom number, we have 60/80. 60/80 for that bottom number.
Okay. And Eva wants to know, is it more alarming if if one of the two blood pressures is higher? Or did you just answer that? You just answered that.
It's totally cool. So so usually studies show that greater risk of heart disease related issues when diastole or the bottom number is bigger. Yeah. So we want to pay closer attention to the bottom number.
All right, good to know. All right, so does cholesterol cause high blood pressure, and how come cholesterol can be? So
sometimes I feel bad for cholesterol, poor cholesterol. Cholesterol is so cool, everyone, and cholesterol is needed, okay? Cholesterol is very needed in the body for so many reasons, and it usually gets vilified as the bad guy. But we really do need the fatty substance. It helps make vitamin D, which protects us against colon cancer and seasonal affective disorder, or that depression that can happen during cold winter months. It builds hormones. We need it to make estrogen, progesterone, testosterone, all those sex hormones. It helps with creating bile, which helps us break down and absorb fat when we eat it. Every single cell has a phospholipid bilayer that has parts of cholesterol in it. And so the integrity of cells and how well they work, they all need cholesterol. So cholesterol isn't inherently bad. I want to make that clear. But when cells need more cholesterol, the liver is going to send it via the bloodstream in packages, with proteins. And all of these things are essentially they're helping to deliver the ingredient to the end organ, and then the body uses stuff and sends not great stuff back to the liver to be cleaned. And that's the problematic stuff. When that's not happening as quickly as stuff is being delivered, we get stuff lost in translation, right? And so cholesterol doesn't inherently cause high blood pressure itself, but when it gets caught in the artery walls, like we talked about earlier, and it starts thickening those walls and narrowing the passageway of that blood system, like the pipe, then blood pressure increases, because now there's less room to fit the same amount of blood, right? It's anytime you put on pants that are a little too small, sticking a lot of stuff in a small space is very uncomfortable, right? The button's gonna pop, the zipper's not gonna go up. And so the artery can't respond, and then we get high blood pressure. So it doesn't directly cause high blood pressure in and of itself, because it's not inherently bad, or cholesterol in general. But having too high bad cholesterol for too long can definitely add to hypertension. But again, it's not inherently bad. It's just when we have too much of a bad thing too often, that's when it can start being problematic.
All right. Well, Gwen had a really good question. She said, should people be worried if their blood pressure is regularly low? So she's heard that athletes can have lower blood pressure, but what if you're not an athlete? Is that a cause for concern?
So if you have chronic hypotension, you might have issues with like your heart, your elasticity of your arteries and things like that. And that can cause, when you don't have great blood pressure, low blood pressure, that means like tips of fingers and toes where capillaries live, those really thin vessels, they're not getting gas exchange. They're not getting cellular exchange. And so the tissue around them starts to break down, and you get, it's called neuritis and neuropathy in diabetics, where they get the numbness or tingles in their fingertips and toes. And that's a sign that blood flow isn't going there, which means nerves are starting to die, which means things will have to be amputated. So that can happen in really high blood pressure over a period of time. And it can also sometimes happen in really low blood pressure, because again, the blood pressure has to be in that middle ground, and too much banging or not enough delivery to the tissue and area are both going to be problematic in slightly different ways. Now, if you've had low blood pressure your whole life, even if you're not an athlete, and you've had an echocardiogram, you've had everything checked out, every milestone in development was met, you don't have any major risk factors of heart problems, then in that case, I wouldn't be too concerned. But if it's something where you were normal for a long period of time and then you went low and you stayed low, I would at least just kind of look under the hood to see what's going on. Go see a cardiologist, potentially get checked out, just to have a baseline and make sure that everything's working as it should work.
All right. What health problems are associated with high blood pressure?
Oh my gosh, so many. Okay, so chicken or the egg? I mean, come on. But when we have high blood pressure before it gets diagnosed, especially, or managed, I should say, if you get a lot of headaches, again, more blood, being just blood pressure increasing in the head, if you're getting nosebleeds, if you are always exhausted or confused, if your eyes and ears start wonky, vision problems, tinnitus in the ears, if you're getting irregular heartbeat, chest pain, just kind of a fluttering or heaviness in the heart, these are all signs that you could have high blood pressure that's not being managed, right? AKA you're not on an herb or a medication to help get it normalized again. And some women that could also mean pregnancy, because especially in women who are pregnant after the age of 35, getting preeclampsia or high blood pressure during gestation is really common, even as early as the first few weeks. So that's also a possibility. But yeah, so those are all signs or symptoms that you could have high blood pressure and not know it. Now, when we look at long-term effects, what's happening over time, we talked about it earlier, the inside lining of those vessels are going to get damaged, and over time we're going to get thickening and hardening of the vessel wall, making us at a higher risk for things like heart attack, stroke, pulmonary embolism, just basically throwing a clot or having an aneurysm, things like dementia. like early onset, all those things are higher risk. Smoking cigarettes, obesity, diabetes, they're all kind of intercorrelated. And usually if you have one or two of those risk factors, the others will eventually kind of develop if they haven't already. We tend to kind of see them all together. So those are some of the signs and symptoms, and then long term, some of the effects when it goes unchecked or unmanaged, what can happen when you have high blood pressure.
Okay, Eva has another good question. She said, is every stroke dangerous? She's heard that some people can have strokes and not even know about it.
So you can have very like micro strokes for sure. People can have damage or old brain bleeds and not even be aware of it, you know. I mean, it can be very minute. It's usually not 100% undetected, but some people will chalk it up to a stressful event, or it's just, oh, it's part of the aging process. I'm just a little more tired than normal. And so not every sign and symptom is going to be overt, and you can absolutely have, you know, issues like that and not know it. And so I think that that's really the important part about screenings and getting, you know, annual physicals and checking things, especially after the age of 40, 45, because again, you know, science has added that extra 30, 35 years to most of our lives. Thank God, knock on wood. And so we want to make sure that the machine is still working right.
Yeah. Isn't there an acronym of like, if you're having a stroke, you look for like a few things? Do you know that? It used to be.
The stroke
Anyways, I'll Google.
acronym?
Yeah, it's like,
Yeah,
there's like four.
Well, I
I
mean,
remember.
I know what to look for, but I didn't know there was an acronym. Let's see.
I think there's an acronym.
Oh, there we
It
go.
starts with F.
Fast. Yeah. Face, arms, speech, and time. So that's what, yeah, for sure. That helps you see definitely the symptoms of acute stress. Or pardon me, stroke. Why did I say stress? Acute stroke in people. Yeah. Yes. So be aware, everyone.
Yeah, I've seen those. It's like it always stands out in my mind of like, there was a news anchor. She was literally delivering the news and was like, I think I'm having a stroke. And she was. And her speech was all slurred. Because what? Well, because she knew her speech wasn't right. Like she could just tell, like words were not coming right.
So the F for face, you know, the face could be drooping. A for arm is you could have a weakness to one or both arms. The S is a speech being slurred. T is, it's known as time, but it's like if somebody's like, something's wrong, call an ambulance. Obviously, it is time. Well, time. So that's for the ST.
Yeah, because if you can get medical attention sooner rather than later, they can prevent some major things that might be happening. Time is of the essence. So fast. Remember fast, everyone. I remember. Now I'm glad we reviewed that because I knew there was an acronym. I could not remember it.
Yeah.
So, all right, let's go back to our brain. And what are some of the recent research on the impact on triglycerides, cholesterol, and blood pressure levels?
So I mentioned one of the Heart Association studies earlier, and I think that that's pretty fascinating that they studied the berberine in all of those people and realized that it elongated life, it helped with congestive heart failure. A study was recently done in China as well with hyperlipidemia, hyper meaning more or big, and lipidemia meaning fat, right? So it's high triglycerides and cholesterol. So hyperlipidemia, they were given berberine over 12 weeks. We all know 90 days, right? And after doing, you know, comparing the group that didn't take anything to the group that took about 500 milligrams twice a day, which is about 1,000 or 1 gram per day, just to give you an idea of dosage. But pretty much everyone in the berberine group saw improvement. And so their blood pressure went down, their bad cholesterol went down significantly, triglycerides went down significantly. Because again, these people have hyperlipidemia. So the idea is to get that to you know, normalize, and they all normalized and dropped, you know, up to 20, 30 points in their cholesterol and triglycerides in that 12-week period, which is pretty incredible. You know, no other lifestyle changes, no dietary changes or exercise changes, only the berberine changed. And then this also helped with the integrity of their blood beats per minute. Their pulse was better, was smoother. I mean, all the way across the board, their oxygen saturation of their blood was improved, all because of berberine. So I think that that's pretty awesome. It's very powerful. And what I think is very cool, and I've said it once during this episode, but I want to say it again. Just because you don't have the tools to measure the efficacy of something doesn't mean that it doesn't work. We didn't have the tools 2,000 or 3,000 years ago with Ayurveda and Chinese medicine to do double-blind placebo studies with something like berberine or mushrooms or any really plant or fungi life. And now we do. And we just knew that it worked. And so I think that it's really important to recognize that modern science doesn't always have the answers, and esoteric medicine is the foundation of health. It's really where a lot has come in. And so to help with studies, disease states, people are really trying so hard. Things like cancer, things like heart disease, that how is such a big problem still? No stone unturned. And it's just really cool to see the medical community starting to look at herbs and alkaloids and things like that, and really back up what, again, esoteric and traditional medicines have known for thousands of years. So I think there's a really big, there's a lot of weight to if it ain't broke,
Mm-hmm.
At least
yeah,
personally.
Totally. Well, I hope everyone's loving this series. And if you're finding it useful, hit the follow button. You can also follow us. Hey, there I am. Middle World Herbs on Facebook, Instagram, Twitter, YouTube, and TikTok. There's like a ton of helpful information about medicinal plants, emotional healing, natural wellness. And we only have like less than 10 minutes left, but I want to get into more about berberine. So we've discussed some of the benefits for supporting cholesterol and triglyceride levels and helping with the good cholesterol. And then I have this supplement. This one has the bitter melon and banana leaf in it. So let's talk a little bit about bitter melon and why it pairs with berberine so well for cardiovascular health. Oh,
yeah, of course. So bitter melon acts more like insulin, and anytime we can keep our blood glucose normal, our arteries will be happy. Our blood vessels will be happy, because when blood sugar is too high, too much sugar inside of the blood can be inflammatory and start causing damage to that inner layer, like we talked about. And that is what adds to cardiovascular disease. So again, a high bad cholesterol and or mismanaged blood sugar, high intense blood pressure, these all add to the potential damage. So there's not usually one singular root cause of cardiovascular disease. It's kind of a little bit of everything. And when we're talking about the bitter melon, by directly acting like insulin and helping pull sugar out of the blood and into the cell, we're helping to protect that inner lining. And so that's why bitter melon is so great, because by managing blood sugar, we're taking away a risk for cardiovascular damage. So that's how bitter melon helps. It doesn't directly address or protect the vasculature itself. What it does is help manage blood sugar. And when blood sugar is healthily managed, then again, we're removing that potential problem.
Okay, awesome. So we often get asked, okay, should I do the berberine HCl Forte or the berberine with banana leaf and bitter melon? So which one does someone choose?
So if you have some cardiovascular stuff, you're teetering on hypertension, maybe you already have it, obviously talk to your doctor about, mixing berberine with your meds. But if you have cardiovascular issues or want to prevent them, if you are pre-diabetic or maybe have some issues with sugar, but you don't have the actual disease state of diabetes, that's when I would stick to just the berberine. Now, if you already have actual diabetes, you are on a plan to address prediabetes or type 2 diabetes, that's when I would definitely look at the bitter melon addition, because you definitely need that extra support in insulin, right? And in blood sugar management, where if it's more for the cardiac benefits and the immune system benefits and a little bit of the blood sugar, the berberine. But if it's all those things and actual diabetes, that's when I would stick with the bitter melon.
Okay. And are there any precautions that people should watch for when they're taking berberine?
Yeah, definitely. So because of the way berberine acts, you don't want to take a drug that does the same job. If we have high blood pressure and we take a drug to get it normal, and then we're taking an herb that does the same thing, we can drive blood pressure too low. if we have type 2 diabetes and we're taking insulin or metformin or a drug, right, to help with that, and then we're taking an herb that does the same thing, blood sugar can get too low. And so we always want to be in kind of that middle ground, whether it's a medication or an herb. Staying within that middle ground is what's going to be safe. And so you don't want to take berberine or any alkaloids like it when you're already on medications doing those jobs, especially at certain doses. It can be very problematic because they can interact. It's called potentiation, making them work better. So definitely talk to your doctor if you're interested in berberine or just an herbal route to try and manage something like your cardiovascular health or diabetes. Very direct medications with blood clotting as well. So if you're taking an aspirin a day to keep your blood thin, let's say, or anything like that, I could just name off a bunch of pharmaceuticals, but if you're on a blood thinner, if you're on a beta blocker, if you're on a statin, all these things that control these issues, you definitely want to talk to your doctor because of potential interactions with berberine.
Okay, and then Eva asked real quick, can you remind us that exact breathing exercise that can temporarily lower blood pressure and how to do it, right?
Yes. So because the blood goes through the heart, every single drop of blood in our body, all 5 to 5.6 liters are going through the heart within 1 minute. So if we can maintain any sort of breath work for at least that minute, then we're oxygenating every single drop of blood in the body. So what we want to do, and there's a few that you can do, but the inhale, hold, exhale, hold is going to be usually the best to calm the nervous system, create parasympathetic nervous system state, the rest and digest, and calm the blood pressure or lower it by at least 10 to 12 points. So just sitting there, laying there, eyes closed, feeling grounded, feeling the bed or the ground or the chair really supporting you, working to relax any tightness or tension in your body, rolling your shoulders back, unclenching your jaw, all that stuff, closing your eyes, really being centered, and then working to inhale to the count of 6 and hold it to the count of 4, then exhale to the count of 8 and hold to the count of 4. You can even do 4x4, which is just inhale 4, hold 4, exhale 4, hold 4. That's easier count. Sometimes a slightly longer inhale and slightly longer exhale can introduce more oxygen and release more carbon dioxide. But you don't have to start there. You could work up to that. But whether you're doing 4x4 or you're doing 6-4, 8-4, doing it for at least 1 to 2 minutes to ensure that all of the blood has been oxygenated and the blood pressure has efficiently lowered is really, as little as 30 seconds can honestly help with heart rate. But if you really want to make sure you're doing a good job, I would say a couple of minutes.
Okay, awesome. Well, we just have a couple minutes left. So to wrap up, if you haven't bought it yet, we are throwing in 20% additional off if you get it during this live. And our return policy is actually 60 days. So if you take it and you're like, this isn't working for me, you could actually return it, even if you've had half of it. So you still get a full refund, which is pretty crazy. So definitely take advantage. Oh, I have hiccups. Take advantage of that. And I was wondering if I was going to hiccup live, and yep, there it was. All right, well, since we only have our minute left and I have hiccups, Jackie, why don't you round us out? Tell us what top 3 things you want people to remember from the show.
Yes, of course. Okay, so 3 things for cardiovascular health. Number 1, remove potential obstacles to the cure, everyone. Please, please, please. If you can 100% remove them, cigarettes, alcohol, pollutants, obesity, all those things. If you can't, completely resolve it, work on moderation, work on lowering it as best you can. Second, use food and substances as thy medicine, please, please, please. Things like berberine, for example, which is found in plants. There are other antioxidants, anti-inflammatory, really powerful things in plants that can actually help do the job better with less side effects than medication. So please look into them. And third, and definitely not least, is to exercise. Move your body. Keep your cardiovascular system strong, keep it adaptable. When we exercise, blood actually goes through the heart 3 to 4 times faster than if we were just sitting still. And the more filtration, the more oxygenation, the better. So those are my 3 things. And when in doubt, bonus number 4, please seek your doctor, get a screening test, ask the right questions. You're worth it. Better safe than sorry. And yeah, that's it for today for the cardiovascular episode. I appreciate everyone taking the time, making my little heart for the heart episode. Thanks for the jokes, Deanne. You got me slapping my knee a couple of times. Those were great.
All Eva. Actually, Eva said, am I still doing my 90-day berberine challenge? And the answer is it's on pause. I want to reset because I started it, and the same week I started it, it was 2 weeks ago, I gained 3 pounds, and that's not normal for me at all. So I'm trying to figure out what I'm eating, what I'm doing. That's weird. And then once I get back to my baseline, I want to do this challenge, but I want to do it right. And I want to also look at my nutrition, because I think my nutrition's out of whack lately. So maybe my sleep, be a million things. Something's not right. So I am going to do that. Can't wait for Deanne Comedy Hour, said Abby. Oh geez, it's pretty bad. But we always love having you on, Abby. So thank you for being such a big support.
Thanks everyone. I appreciate it.
Bye.
Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us. Flowers, leaves, and roots within. Hear the mind calming you, soothing you. Love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herb.